Hello, my name is Sarah Douglas, and I am the Director of Patient Engagement at the MPN Research Foundation. I'm a hematology oncology nurse, and I really have a passion for helping patients and caregivers understand their treatment options and how they really can share their experiences and their journeys. And today I'm here with Dr. Patel. Dr. Patel, would you please introduce yourself?
Yeah, thanks so much for having me, Sarah. My name is Anand Patel. I am an assistant professor of medicine at the University of Chicago, and I'm part of our acute leukemia and myeloid malignancy program. I focus on taking care of patients with myeloproliferative neoplasms, and I am a clinical investigator, so also involved in clinical trials, looking at novel therapeutics for patients with these blood cancers.
Great. Well, we're lucky to have you here today. Can you start by explaining what myelofibrosis is?
So myelofibrosis is a subtype in a family of chronic blood cancers called myeloproliferative neoplasms, or MPNs. MPNs, the way I like to think of them is what unites them is that they are driven by an on switch in the bone marrow, the factory that makes healthy blood cells that won't turn off. That pathway is called JAK-STAT. So they have a JAK-STAT pathway that won't really turn off. And that can be for a variety of reasons, including mutations in different genes that serve as on and off switches. So three common ones are JAK2, CALR, and MPL, MPL. But patients can have other mutations beyond those. Now, MPNs, while they kind of share that commonality, what we see in the clinic and what symptoms patients may have can be quite different. So the three most common MPNs are polycythemia vera, essential thrombocythemia, and then primary myelofibrosis. So polycythemia vera is typified by having a high red blood cell count and hemoglobin. Essential thrombocythemia is typified by having a high platelet count, which are our clotting blood cells. In primary myelofibrosis, there's not a clear-cut pattern to what blood counts can look like. It really depends on where you catch someone in their journey. If it's early on, their blood counts can be high. If they're later in their disease course, the blood counts can be low. And the reason for that, kind of really what separates out myelofibrosis from PV and ET is that there is increased scarring or fibrosis of the bone marrow. And with time, if you kind of think about that analogy of the factory, if there are parts of the factory that are burning out, with time, we're not going to make the blood counts we need. So ultimately, patients with myelofibrosis will go from this high blood count stage to then having blood counts that drift down and are low. So I think when kind of considering why myelofibrosis is different from PV and ET, I'd say the biggest reason is the low blood counts. Patients have to manage low blood counts, and with that, the spleen can become very large and cause symptoms as well. Um, Myelofibrosis is quite variable in terms of how patients do with it. Some patients can live with myelofibrosis for years and just need active surveillance. Others may need something like a stem cell transplant to try and cure it.
Excellent. Can you discuss really how common MF is compared to the other MPNs?
Yeah, absolutely. Um, the first thing I'll say is MPNs are considered a rare cancer. So, when we say rare cancer, that means less than 40,000 people a year in the United States develop this. And when we're talking about MPNs, even when you add them all together, it's far less than that. So, myelofibrosis, in and of itself, if you think about primary myelofibrosis compared to PV and ET, it's the least common. However, both PV and ET can, with time, turn into myelofibrosis, what we call secondary myelofibrosis. So, patients with PV and ET do have this risk of developing myelofibrosis down the road. And typically, that can take several years to happen. But if you kind of think of myelofibrosis, whether it's primary myelofibrosis or secondary myelofibrosis, and kind of put them together, it becomes a little less rare than we would think. Although still, most patients with MPNs have either PV or ET.